This is unexpected, but I need to speak seriously. If you or someone close were to fall, if you break the bone at the base of your leg, the hip joint, it's said that 1 out of 5 people will pass away within a year after that. There is some really harsh data about this. The fact that a fracture can even be life-threatening is actually common knowledge among us medical professionals. But don't worry, you can start strengthening your bones at any age. You may worry about fractures or doubt your bones will get stronger, if you feel that way. By the end of this video, I believe your vague anxiety will turn into real hope that you can take action. Let's learn the latest knowledge together to help reduce the risk of fractures in the future. So this video is about calcium, which is essential for bone health. First, in the first part, I would like to talk about the dangerous symptoms that can occur when you don't get enough calcium. Next, using Japanese statistics, I'll clarify just how much calcium Japanese people are lacking. In the second part, I'll explain how to get calcium without just relying on dairy, which I know many of you have been waiting for. It's fine if you like milk, but I think there are many people who can't drink a large amount of it. Foods other than milk that are high in calcium. What kinds of foods are there? I'll explain with some simple recipes, so please give them a try. In part 3, for those who are busy and may lack calcium, I'll suggest smart choices. This is a stick type, so you can quickly get your calcium. This also includes a supplement promotion. I'll present it fairly and neutrally, as a doctor. We take full responsibility for all the content in this video on our channel, so please listen until the end. So, first, in this first section I'd like to talk about the serious risks of calcium deficiency. When you think of calcium, some of you might also think of vitamin D. If you did, you're very studious. I've talked about this in a previous video as well, but of course it's important for your bones. Vitamin D is extremely important. That's because vitamin D promotes the absorption of calcium, which helps strengthen your bones. That's why I've mentioned many times that it's important to eat foods containing vitamin D and to get sunlight so your skin can produce vitamin D. However, there's something very important I need to tell you all. In fact, there's a very significant pitfall. Actually, just taking vitamin D alone does not guarantee bone health at all. This was shown in studies conducted in the United States. It involved about 25,000 people. In the study, healthy middle-aged and older adults took vitamin D supplements. But unfortunately, the results showed that the number of people who suffered fractures did not decrease. You might be wondering why, right? The reason is actually very simple, no matter how great vitamin D is. To put it simply, vitamin D only plays a supporting role. That's because, as I mentioned earlier, the main function of vitamin D is to promote the absorption of calcium. In other words, if you don't get enough calcium, which is the basic ingredient to begin with, no matter how much vitamin D you take, it won't help. Even with vitamin D, your bones ultimately won't get stronger. Besides that, if someone already has enough vitamin D, even if they take vitamin D supplements, but I think it also means it's pointless. Supplements are meant to make up for something. It's important to take them because you're lacking something, and I think this suggests that it's not good to just take anything and everything. People often mention calcium, but I'm sure of my bones. Despite many falls, I've never broken one. If you're thinking, I'm not that worried about it, actually, the risks of calcium deficiency aren't just about your bones. Have you been feeling more irritable lately, or waking up at night or early in the morning because of painful leg cramps? On top of that, if your blood pressure has been rising lately, it's because calcium doesn't just affect your bones, it also impacts your mind and body. It's a vital mineral that you simply can't ignore. Up to this point, I've talked about the importance of calcium. Taking vitamin D doesn't matter if you don't get enough calcium, which is most important. How much calcium are Japanese people really lacking? Japanese data shows how much calcium we actually get from our daily diet. Calcium is 500 mg daily. The government recommends 650 mg for women and 800 mg for men. On average, Japanese people are lacking about 200 mg of calcium per day. Filling this 200 mg gap is very important for keeping your bones strong in the later years of life, so you can maintain strong legs and hips and have a body that is less likely to fracture even if you fall. And I think people who can't consume a lot of dairy products are especially likely to be deficient in calcium. So how can you fill this 200 mg gap? Don't worry. In the second and third periods, I'll introduce efficient solutions to fill this gap effectively. But sensei, is it still possible to build up bone reserves from now? On television they say bone mass peaks at around 50 years old. After that, I heard it keeps decreasing more and more, and I often get questions like this. So, is it already too late? Is it pointless to try hard from now on? If you're thinking that, please wait a moment. It's true that it's difficult to dramatically increase bone mass. However, it's said that both bone quantity and quality are important, and preventing the loss of existing bone as we age, in other words, maintaining our bones, is an important perspective. Not letting these bones decrease. This effort can be made at any age, and that's also true for bones. There is metabolism, and osteoclast cells break down the bone. Meanwhile, new bone is constantly formed. It is said that by maintaining the balance between bone destruction and formation, you can keep your bones healthy. This is what we mean by bone savings, which you can do even in middle or old age. Stay hopeful and keep listening. Now let's take a moment to see if your calcium levels might be low. You might have weaker bones. Let's check for signs. I'll show you an easy way to do a self-check. I'll introduce 4 self-check methods. Please try it yourself while watching the video. The first one is the wall test. Everyone, please move close to the wall and press your heels, hips, and back against the wall. In that position, can you naturally touch the back of your head to the wall? If your head doesn't naturally touch the wall, it's a sign that your back is rounded. And the main reason why your back becomes rounded, one of the most common causes, is a fracture of the spine. In fact, spinal fractures often occur without pain and the bone naturally collapses. Cases like this happen, so check if your head touches the wall. The second is the height test. Is there anyone whose height has decreased by more than 2 centimeters compared to when they were in their 20s? This could also be due to compression fractures in the bones of the back, causing your height to decrease. That's one sign. The third is the kyphosis test. It's not really a test, but waking up at night or early morning from leg cramps. If that happens more than twice a month, it could mean you're lacking calcium, which is an important mineral. And the fourth one is the nail test. If your nails are brittle, break easily, or appear thin and layered, that's another sign. Does anyone here have nails like that? It's not just about calcium, but the components that make up nails and bones they're similar to proteins and minerals. So, if your nails are brittle, it's possible that your bones are also becoming brittle. There's a possibility, so please take a look at your own nails. If you think even one of these might apply to you, please do. Please keep listening after the second period as well. So in the second period, I'd like to introduce 30 different ways to add a little something extra to your meals without relying on milk. This time, I'll be introducing Japanese foods, so there should be some items you're already familiar with. Even if you don't like milk, adding a little of these to your meals will efficiently boost your calcium intake. I'll be introducing 30 such foods. Here are 3 ways to efficiently get calcium, and the first is soy products. And what I especially want to highlight this time is momen tofu. Do you all usually eat tofu? Among soy products, momen tofu is especially rich in calcium. Actually, during the process of making momen tofu, nigari is added when the moisture is squeezed out. So, what exactly is this nigari? Since it's calcium, momen tofu contains more calcium than silken tofu. Actually, just about 1/3 of a block of tofu contains around 90 mg of calcium, so by consciously eating tofu, you can make up for about half of your calcium deficiency. And as you all know, soy products contain a component called isoflavones. These are very beneficial components for women, because their structure is similar to estrogen. When female hormones are low, menopause symptoms like sweating or trembling hands and feet can occur. It helps to alleviate various symptoms such as getting tired easily and feeling irritable. They say so ladies, please consider buying it. Please try it. For tofu recipes, I recommend miso soup with firm tofu. It's a classic. And please be sure to add your favorite type of mushrooms to it as well. The reason is that many kinds of mushrooms are actually rich in vitamin D. In other words, firm tofu. If you get calcium from firm tofu and vitamin D from mushrooms, the calcium you take in will be efficiently delivered to your bones. So, if you want to take care of your bones, remember to add firm tofu and mushrooms to your miso soup starting tomorrow. Keep that in mind. The second efficient way to get calcium is komatsuna, Japanese mustard spinach, which is unexpected. Many of you may be surprised, but it contains a lot of calcium. Many of you probably thought of spinach when it comes to green vegetables. Of course, spinach is also a very important vegetable, but actually spinach contains oxalic acid, which may inhibit calcium absorption. Komatsuna, on the other hand, contains much less of this oxalic acid, which is often considered bad, so Komatsuna allows for more efficient calcium absorption. Amazingly, eating just a small bowl of Komatsuna has about 120 mg of calcium, so a small bowl provides over half of the 200 mg many people lack. That's right. Furthermore, Komatsuna also contains vitamins that are necessary for bone formation. It is also rich in vitamin K. Vitamin K acts as the glue that helps calcium adhere to your bones. It makes sense. It's a very beneficial vegetable. For a simple recipe, I suggest, how about Komatsuna with sesame dressing? Simply wrap washed Komatsuna in plastic wrap and microwave. You can boil it quickly to save time, or just stick to boiling if you prefer not to use the microwave. Next, squeeze out excess water from the Komatsuna, add ground sesame seeds, and pour in mentsuyu. Just mix it together. That's all it takes for this simple Komatsuna dish. You can make gomai just like that. If you use the microwave, it only takes about 3 minutes to prepare. Sesame seeds are also rich in calcium, right? So when I want to efficiently get more calcium, I often eat Komatsuna mixed with sesame seeds. If that's too much trouble, you can buy it frozen at wholesale supermarkets. Just adding cut Komatsuna to miso soup might be enough. Miso soup with Komatsuna and tofu. If you make it, you can get calcium even more efficiently. Efficiently getting calcium. The third way is shirasu. Many people know that small fish like shirasu are rich in calcium. Don't you think so? Honestly, out of the 3 I've introduced so far, I think shirasu is the most impressive and excellent ingredient. The reason is that shirasu alone as a single food, you can efficiently get both calcium and vitamin D. I also introduced shirasu in the vitamin D video. 2 tablespoons of shirasu contain about 100 mg of calcium, so you can supplement about half your calcium deficiency. You can do that. I recommend a shirasu rice bowl as my recipe. The reason is because it's simple. No matter how busy you are, just cook some rice, put shirasu on top, and add a little soy sauce. Even this alone makes a nutritious meal. If I want to treat myself a little, just adding an egg yolk as a topping makes it really creamy. By the way, I often use the leftover egg whites by mixing them into miso soup. Eggs are also rich in vitamin D, so putting an egg on top of a shirasu bowl is actually a very reasonable way to eat it. By the way, when you eat shirasu, do you prefer kama-aji shirasu or chirimen jako? Kama-aji shirasu is fluffier and tastier, but if you compare them by the same gram weight, chirimen jako, because this one is dried, it actually contains more shirasu. This one contains more calcium and vitamin D. If you want to efficiently get vitamin D, chirimen jako might be more suitable. Honestly, I think it's fine to choose based on your personal preference. What do you think? Isn't it surprisingly easy? Momen tofu miso soup, komatsuna with sesame dressing, shirasu rice bowl. Try to have these calcium-rich foods about twice a day. If you can do that, you'll be able to get the calcium you need each day. But you can't eat shirasu every day after all. Cooking komatsuna is a hassle, and I'm also tired of momen tofu. I totally get how you feel. When you're busy and end up eating out more often, like on business trips, it's easy to miss out on these kinds of nutrients. There are days when I'm so busy that I just have bread and coffee and head off to work. On days when you can't do your best, this helps cover your calcium intake. In times like that, my option is supplements. I think it's good to have supplements as one of your options. That said, there's so many different supplements out there, so I think a lot of people get confused about which one to choose. Before discussing products, knowledge is key. Calcium has many considerations, so which supplement should you choose? I'll explain from a doctor's perspective. Absorption efficiency is the first point. Calcium as a mineral is characterized by having poor absorption efficiency compared to other nutrients, so it's important to look at what the absorption rate is. Having this perspective is important when choosing supplements, and the second point is the best supporting nutrient, vitamin D. I think it's also good to check whether these are included at the same time. Vitamin D promotes the absorption of calcium, which has poor absorption efficiency. That's what vitamin D does. If you can take them together as a set, I think that certainly makes sense. Of course, please also check whether you are lacking vitamin D or not. Review your diet, watch videos, and see for yourself. The most important thing is whether you can keep it up. Of course, I don't think you need to do it every day. Today, you're not getting enough calcium. It's important to take it on days like that. But with supplements, it's always about the taste or the form. And since the amount and number of times you take them can vary, if they don't taste good, you might end up stopping taking them altogether. There are also cases where there are too many tablets, and it's hard to swallow them, so people end up disliking them for that reason too. Actually, it's important to choose something that doesn't make you feel stressed when taking it as much as possible. Keep these 3 golden rules in mind. I think it's wonderful if you were able to change even one of your actions. If you'd like, please let me know in the comments, like, I think I can try this, or I tried using tofu right away. Please share your challenge in the comments. By sharing your intentions, you might encourage others, and declaring your plan will also strengthen your own actions. Lastly, please let me say this. The fact that you are spending this much time and seriously learning for your own future and health. This is a great first step for your bone health. Habits often fade, but sometimes, unexpectedly, you might remember this video and start making it a habit again. That's how it is. One of the things you learn today will surely protect and support you 10 or 20 years from now. It's okay if it's not perfect, so please try at least one of them. At YouTube Medical University, we share data-driven medical insights from a doctor's view to help people get healthier starting tomorrow. We share key information to help you thrive in your later years. I'd really appreciate it if you could subscribe to the channel so you don't miss any new videos. And if you found this helpful, I'd be happy if you could hit the like button. Living in your 70s and beyond without aging. This is how I want to live. Such a lifestyle exists. It's filled with stories that I've learned from so many patients. I've learned from my seniors that talking with friends matters more than exercise, and with medicine, less is better. It offers advice for healthy, happy living at any age. See the description below.